I'm Dr. Even Wang. I'm a neurologist with Genesis HealthCare. I deal with conditions of the brain, nerves, and the spine. So that includes conditions such as migraine headaches or headaches in general. Also, we deal with problems of the nerves and the spine. For example, people come in with difficulty walking or they have numbness and tingling in a particular part of their body. Of course, we deal with strokes and also immune disorders of the nervous system, such as multiple sclerosis. I chose neurology because I think neurology is a fascinating field. The way the human brain connects with the rest of the body, it's almost like a puzzle. And the way patients present with problems, it's not typical like, oh, I come in with chest pain, but rather I come in, oh, I can't move my arm, or I can't use a part of my body. And you have to try to figure out, exactly what's wrong with them, or part of the brain, what part of the nervous system is a problem. I just think that's fascinating to me. That's why I chose neurology. I think a lot of patients I will be able to see are people with migraine headaches, and the treatments have advanced tremendously over the past few years. I'm very up to date with the current treatment of migraine headaches. We use the CGRP inhibitors, the monthly injections. We use Botox injections, for example. And also, we sometimes will do genetic testing for patients to try to find out, is there any genetic causes to this condition? There's so many new treatments in the field of neurology. Like 20 years ago, there's not a lot of treatment. You can diagnose somebody with multiple sclerosis, and there's really not much you can do about it to slow down the decline of the condition. But nowadays there's like 20 MS medications to choose from, and a lot of them are very efficacious. And same thing with migraines, and also genetic testing. Like I said before, genetic testing has really helped with diagnosing problems that has previously cannot be diagnosed. But you can bet that if there's a new treatment for a particular condition, you'll be able to get it here at Genesis. My favorite part of being a doctor is seeing somebody improve and able to help them answer their question. A lot of time patients come in puzzled of what is wrong with them. I like that I'm able to educate them on what might be wrong with them and go through some diagnostic procedures and try to come to an answer and hopefully help them. With every single patient, you try to learn something new. Whether it's your decision process, maybe you thought this patient has something and you were sure about it, but actually they have something else. I think that really, you gotta make sure you're not too biased. So I'm always trying to get feedback from every patient I see and try to improve the way I make decisions. And then I think really over time, I think it does humble you, because when you first come out, you're very sure of yourself, but gradually with more experience, I think patients tend to humble you, and you just try to learn, and do the best you can, and try to improve, over time.